friends, hello everyone. Your favorite segment unbox, just kidding, I'm joking. Your favorite segment before and after. We made the first video, the second video with my friend Oleksii. We did a circular BLEPHAROPLASTY. We did it at the Berezovsky clinic, Dr. Berezovsky's clinic. And of course, before, after, what the result is, whether Oleksii likes it, whether the doctor likes it, whether I like it, and whether it's a reason for me to get rid of these bags. Friends, this is Andrei Berezovsky, the Hexplorer channel. No, just look at what? The beauty we have with Oleksii. We watched this video. We ask and provoke me into my transformation. This is Andrei Berezovsky from the Berezovsky clinic. This is after BLEPHAROPLASTY. We just watch and let's go.
Blepharoplasty is everything related to the eyelids, either the upper eyelids or the lower eyelids. And here we can remove excess skin, take away the bags, and restore the shape of the eyes or slightly change it. We also work with the entire orbital area, and if we have deficiencies in the fat bags, we can fill them in. First, it's the excess skin. This is upper blepharoplasty because it is the most commonly performed. This is the procedure that is the easiest to transition to. It has the easiest recovery, it's a quick surgery, and after this surgery the patient goes home right away, and on the 5th day the stitches are removed and they already look more or less normal. So this is upper blepharoplasty. But in general we perform upper blepharoplasty, lower blepharoplasty, and circular blepharoplasty as a whole. And there are also subspecies, like transconjunctival blepharoplasty. This is when we don't need to remove excess skin, but we simply remove the excess hernias from the lower or upper eyelids and fill them with lipofilling, like the hollows under the eyes, for example. What did we have? What did we do? We had large bags, and on the neighboring area the grooves were quite evident. And we performed such a classic lower blepharoplasty. We removed the hernias, tightened the tissues, strengthened the ligament to prevent bags from appearing in the future, lift the upper eyes. See, we have no bags. And a smooth contour. And we look straight at the smile. And there isn't much excess tissue, so we don't have a pronounced fold.
And what did the upper one achieve? Did you do what you wanted, and did it work out or not?
It worked out for the upper one. We applied a stitch that tightens it and fixed it here to the eye area. As a result, we avoided the appearance, which is very common in men, or generally a naturally weak lower eyelid drooping down, always. And this way we preserved the eye shape, and at the end of the operation, when we removed the bags, tightened everything, removed the excess skin, filled the hollows under the eyes with lipofilling and raw. And as a result, we don't have any hollows here. And where are the scars? The scars are here. Let's look up. Here are thin lines if we close the eyes. There is still some swelling here. Over time it has reduced significantly, but right now this tissue is swollen. And the drooping on the eyelids will decrease further once the swelling subsides. It has already started to go down. In men, generally, it often occurs. Well, this is a complication that is considered normal, and this is called chemosis, which is the swelling of the eye's conjunctiva, meaning a yellowish fluid accumulates under the conjunctiva and it looks like a watery swelling on the eye. And because of this, there can be a direct lag of the eyelid. This does happen during rehabilitation, sometimes lasting for a month or two. Usually this occurs in older patients and most often in men. And we also resolve this by applying this suture and strengthening the eyelids. If the lower eyelid was weak, then this chemosis could be more likely. Plus, we have lipofilling smooth lines. Absolutely wonderful. I think this is a success. Also, lipofilling might not have settled as well. There could have been significant depressions before the surgery, and it might have contoured. We have neither of those.
And perhaps contouring.
There was a bag here, and lipofilling contouring is usually lower. It's like a sausage that appears here. It's a rare case, but it happens sometimes. Sometimes the tissue itself becomes heavily scarred from peeling, and then it happens. Usually when we exclude it, we puncture collagen there a few times.
Remy?
There are also painters' swellings after blepharoplasty. And these swellings, if they occur after blepharoplasty, can be treated with a hardware microneedle reflift in a month or two. This helps to seal the fats that cause swelling and also improves the situation. And it needs to be maintained with Botox. No matter how you twist it, no matter how you stretch blepharoplasty, you will still have it. This operation is not for wrinkles, unfortunately, but for bags, for contour, for excess skin. Wrinkles will still remain if you smile. Now smile. You see? Still.
The pants sagged, not the complaints.
Crow's feet will appear because your orbicularis oculi muscle is working.
Why? Because geese walk on it.
Because geese walk. Because that's how it happens.